This was a new profession, and we knew one slip up, the whole idea could go down the tubes. And so, yes, we definitely felt like pioneers.
Okay, I'm out. Okay, he's out.
The year was 1965. Astronaut Edward Higgins White became the first American to walk in space, and the U.S. was sending its first combat troops to Vietnam. On the healthcare front, President Lyndon Johnson signed the Medicare and Medicaid bill into law. And in Durham, North Carolina, a visionary chairman of medicine gave wings to a revolutionary new concept in healthcare delivery. That year, Duke University's Dr. Eugene Stead coalesced a shared vision to train former military medical corpsmen to become physician assistants, and launched the nation's first formal training program for this new profession.
I came to Duke during a period of time when there was a shortage of all types of medical personnel.
The need for help for doctors was immense, spurred by the Medicaid and Medicare bill, hundreds of thousands of servicemen and women returning home from World War II and raising families, and by a growing move by physicians to specialize as new technologies like cardiac catheterization and kidney dialysis became available.
It seemed an ideal opportunity to take advantage of the fact that people without theoretical training could learn to do highly specific jobs if they were properly supervised and if they had the opportunity to repeat these experiences many times.
Dr. Stead was a doer. He saw a problem, he looked for solutions. He had the ability also to bring talent to a situation.
Dr. Stead and visionary Duke nurse Thelma Ingalls had tried to address the shortage of healthcare personnel in the late 1950s by proposing an advanced practice level nursing program to give direct help to physicians, but that program failed to be accredited. In 1965, the Duke PA program launched and enrolled its first 4 students, all former medical corpsmen: Ken Ferrell, Victor Germino, Richard Sheely, and Don Guffey, who eventually left the program to pursue a career in military ministry.
When it was such a new concept, we had to band together, stick together, so we spent lots of time together, supporting each other, encouraging each other.
We were going to be pioneers, that we really had to toe the line and not foul things up. It was something real special.
Soon the national media came calling, and Look magazine featured a prominent article about Duke's innovative new program.
It was a great article. It really did a lot to help introduce people all over the country to the PA concept.
But there was one big problem.
They titled it More Than a Nurse, Less Than a Doctor. The nurses just went berserk over it, and it damaged a lot of the relationship. They were trying to get rid of this image of being the handmaiden of the physician, and this idea that someone with less education would be giving orders through the physician to the nurses, that just didn't settle well with nursing at all.
The nurses were on our side prior to that, but once that came out, they really took us to task on that.
I mean, we could hardly walk down the hall without being cornered by a nurse, saying, "What do you mean, more than a nurse?"
It took a long time to win nursing back over.
After the Look article and a story by Reader's Digest, applications poured into the Duke program. Duke's first PA class graduated Ferrell, Germino, and Sheely on October 6, 1967. In 1987, October 6 was established as National PA Day. October 6 also happens to be Dr. Stead's birthday. Soon after Duke's first graduation, other programs opened around the country, many of them started by Duke PA graduates.
Paul Mosen went to Yale and got that program up and running with Fred Sadler. Jerry Wise went to George Washington University. He got a program started there. Bill Stanhope, Tom Gotkins, Roger Whittaker went out to Oklahoma.
Other programs started at Northeastern, Johns Hopkins, Emory, and others. Duke continued to play a leadership role in the profession. Dr. Harvey Estes took over the Duke program in 1967 and hosted a number of national conferences at Duke in the late 60s and 70s. Estes was a leader in the development of state standards and eventually national guidelines for PAs.
Duke is very proud of its leadership role in the development of the PA concept. For example, in 1968, the American Academy of Physician Assistants was formed by Duke students and graduates and was incorporated in North Carolina. The story goes that the students were so poor they had to go to Dr. Estes to get the money to actually incorporate.
Today, there are more than 100,000 certified physician assistants in the United States and close to 200 physician assistant educational programs around the country. Physician assistants are firmly entrenched in the healthcare system, providing much needed care in every corner of the country.